Throughout the day, we had the opportunity to hear from so many different individuals, sectors of industry and the like on the different ways that healthcare is being disrupted and the different models that are being taken on. And this session is looking at the role of individuals, and in particular, the role of philanthropists who are no longer writing checks to drive change, but who are leveraging their intellect, their influence, and their passion in unconventional ways to solve some of the world's most intractable health problems. So many of you know the panelists to my left. They exemplify the spirit of innovation in philanthropic healthcare. I won't introduce them formally because, again, many of you know who they are, but I'll give sort of a quick bio for you. Christy Turlington-Burns wears many, many different hats. She's a model, entrepreneur, spokesperson, she's a filmmaker, and an advocate. And in 2010, Christy premiered her documentary,
No Woman, No Cry.
No Woman, No Cry. I knew I was going to get it wrong because it's kind of like a song title. No Woman, No Cry, which focused on maternal health, an issue that she's been passionate about for many, many years, and simultaneously launched Every Mother Counts, which we'll hear about as well. And Dikembe Mutombo, many of you know who he is as well. If you don't know his career prior to what he's doing now, just by his sheer height, you may have a sense of the profession that he is in. He is the CEO and chairman of the Dikembe Mutombo Foundation. And since launching that foundation in 1997, he went from being one of the NBA's most celebrated players to one of the most tireless advocates and champions for change for his home country, the Democratic Republic of the Congo. So I thought to start off today's conversation, which is really understanding what they do, getting a better understanding of how they're approaching these critical issues and the models that they're taking, and how we can scale those across diverse sectors. I thought it would be helpful for them to each have the opportunity to give a quick overview of how they got into what they're doing, the models they chose, and where they are today. So Dikembe, I'll start with you.
First, thank you for having me here. My organization, the Dikembe Mutombo Foundation, built a $30 million hospital, which was opened in 2007. We have treated more than 130,000 women and children. What we've been doing, because it came from myself, I just got tired to see people dying in Africa, especially in the Democratic Republic of Congo, where the mortality rate is 43 for women and 42 for men. So we're trying to do something if we can improve that. And that's why we built the hospital.
And you say that very modestly. This was a vision 12 years in the making, the first modern healthcare facility in the capital of his home country, not to mention done so amidst profound civil unrest in the country.
Yes.
Many, many naysayers and skeptics, and we'll hear more about that in a little bit. Christy, tell us, very, very extraordinary journey. Christy, you've taken on skeptics and, again, formidable obstacles in a different way than Dikembe has in terms of the cause that you've championed. Tell us how you were inspired to start Every Mother Counts and the model and approach that you're taking to this issue today.
Sure. Well, my activity in this area has really sprung from a personal experience. 10 years ago, when I first became a mother, I experienced a postpartum hemorrhage, which is the leading cause of maternal mortality in the world. And at that time, the global figures were to the tune of 500,000 plus women and girls that were dying every year. I learned, once I was trying to understand what had happened to me, that figure, and it really struck me. I mean, I was sort of outraged to know that that was happening and that we didn't know it, that I didn't know it, that my peers didn't know it, that my friends didn't know it. But what really inspired me was the fact that 90% of those deaths are preventable. Now, the numbers have come down drastically since that time. But what I started to do as I came across the information was to go out and learn more. I went back to school to get my master's in public health. I started to travel with organizations like CARE and like RED and the One Campaign. And through that process started to document stories of other women like myself. The difference was that not every woman has access to the critical health care that they need at the time that they need it. So Every Mother Counts came out of the film, which really was bringing those stories, connecting our stories collectively, and so that we could see that we have a connection to one another through this universal experience of motherhood. And Every Mother Counts really was to kind of create a platform, really, so that people could engage in a meaningful way. I think there was a lot of discussion around maternal mortality starting to happen around 2010 when the film came out, and I wanted the film to be a tool for everyone working in that space. But what was missing were everyday people who were the people that I think most relate to this issue and who could really add something and contribute in a meaningful way. So Every Mother Counts was really created for that, and that's what we've been working on since 2010. Give people ways to plug in and ways to be useful with something that they find meaningful.
Dikembe, you also took a similar approach in creating opportunities to offer the most basic health care to people in need, extraordinary unmet needs. And I mentioned earlier, extraordinary obstacles as well. When we're looking at either regions or diseases or issues that have these seemingly insurmountable challenges, describe the process from which, when you had this vision, to actually be able to execute on building this hospital and now creating a model that many people, not only in your country, but across the entire continent, are looking to.
From a long time, we knew that with my statue, we can find a way to create a model that can allow everybody to follow. We went there with all of the challenges that we was facing, especially in a country that was going in a civil unrest, to build a modern hospital, to hire more than 420 doctors and nurses, to make sure that people are coming to work, no people are stealing the equipment, to make sure that we attacked the problem that we was facing mostly was the poverty and the disease that most of the children and the mother that was dying from. And we did that. We're so happy today for the fact that the hospital are becoming financially free. And we have launched our endowment to get the endowment for $10 million in the next 4 years. And many people are asking us, how did you do it? I think we use a lot of discipline and so many rules. We establish some of the rules that we make sure that the people are on time. Nobody cannot leave the hospital without having the bags checked. And we were just checking all of our employees and then patients and visitors. And I think that's where we saw the success. And we recruit a bunch of organizations, especially corporations, who use our hospital to help us cover with the 52% of the losses that was going for the poor.
Christy, you have talked about the importance in the work that you do in the advocacy work and your mobilization campaign on these types of collaborations and really creating a network of like-minded partners across varying fields to drive change, that you can't do it alone anymore. What has been some of the more effective types of strategic partnerships that you think organizations such as yours need to be adopting and need to be thinking about to drive impact-driven results and actually move the needle forward in areas where many organizations with much larger budgets just haven't been able to?
I think there's been such a trend and one that I think is sustainable, which is in the private and public partnerships. That kind of conversation was happening a lot as I started to get engaged. And so there were opportunities to partner at every level. Certainly when traveling to many different countries, there are the very, very small on-the-ground NGOs that are struggling because nobody knows what they do and they don't have access to others and they feel very dislocated. or disconnected from the large ones. And then there are the very large ones that don't allow for people who want to help and contribute and feel connected to the cause because they're too large and it's too difficult to have that personal one-to-one experience. So I feel that there was a great opportunity to partner with large and small organizations and bring large and small organizations together. One that we've joined, which is an interesting one, and it's one of the larger ones that, we're by far the smallest one, is one called the Saving Mothers Giving Life Initiative, and that is with the State Department and USAID, as well as the Norwegian government, the American College of OB/GYN, and Merck for Mothers, which is a big initiative addressing maternal mortality. And together, we are stronger because we can contribute different skill sets. And then we can reach out to our networks and bring more people and more voices in. I think sometimes what's another barrier to women and everyone really accessing critical care is the sort of coordination of so many different people doing different things. But coming together with the idea that small groups that bring different focuses and different talents to the table, that's really the way to move things forward. And I feel that that's been one of the ways that I think we've gotten a much larger reach than we would as a small organization on our own.
Dikembe, you said that you couldn't have done this alone, but yet when you started, you were met by huge skeptics, not just in your own government, who were suspicious as to why you would be doing this, what ulterior motive did you have, but also within the private sector. Are you someone who can drive results when many people, again, have great intentions, passion, but aren't able to execute? Why were you different, and what are the lessons to be learned for other like-minded efforts in actually taking vision to action to results?
Oh no, it's a good question. It's not easy to turn a vision to the reality. A lot of us here in this room, you have a vision, you have a dream to accomplish something big, but sometimes our vision cannot become a reality. That's part of our life. But for me, I was facing with so many challenges from the U.S. government, from the State Department, USAID, people at CDC, you name a few. You go in the African community, African leaders, there was like, what's going on? What is your agenda? What is your mission? And because so many people felt that it was a political motive. I was doing it, so I can use that as a campaign to run to becoming a president one day in Africa. So.
Are you going to be?
No, I'm not in politics.
You heard it here first. No.
I'm a philanthropic, so that's where I'm going to stay. So I just want to save life, and that's the reason why. But I went there and I extended my arm to so many pharmaceutical firms who joined me, like BD and others, the UN, the UNICEF. There's a bunch of organizations that we work with the UNDP. We work together and the World Health Organization to solve the problem that was facing the continent. And I'm glad today that to see that all of those partners stay with me and we can see the result.
So action and putting points on the board has been critical for you to be bringing people along the way to lend their support and their collaboration. Christy, I know that's the case for you, and when you and I spoke, you talked about the importance of transparency and also to create the much needed engagement, having that connectivity with all people, all constituents involved in the process. How do you define and measure success today in the work that you're doing, both on a macro level, but in ways that actually effectively articulate your message and show that you're a successful entity in actually fulfilling your vision?
Well, we've used the measurement of taking action, and that can be used in a very wide array. It can be anything from sharing stories that we share, because we've been really a storytelling organization, to inviting people to write stories, because I think perspectives, this is a tragedy that is a global tragedy. We have as much of it's a different set of numbers, but we have a serious problem in terms of maternal health and access to care for everyone in the United States as well. So inviting people to to be a part of the conversation, and giving them a platform where they can share and they can spread those stories, has been a big part of the way that we count that. We also do a lot of, we get out there and we organize, we do the marathon, which a lot of organizations do, but we've done it in a way where we connect one of the biggest barriers for women accessing care in developing countries, which is distance. So the marathon has become this great communication tool for us to say, 5 kilometers is the minimum distance women will have to walk to access any kind of care. 35 kilometers is a pretty average distance she would have to be transported for emergency obstetric care. That has really struck people, and we've had this incredible connection with this running community. And guess what? A lot of runners are moms. So we've had this really interesting kind of grassroots success with people who have that connection, who can physically take an action that they might already be doing, but dedicate that energy and that effort towards something that's larger than themselves. And that makes everyone feel better, and it also brings so much more energy to the women we're trying to serve.
Both of you have talked about the incredible learning along the way since you started your foundations, many surprises than what you initially expected. Dikembe, when you look at this trajectory, what was the toughest lesson that you had to learn that's been most formative for you in sitting here today and talking about the success of the hospital and the opportunities to continue on your vision moving forward?
I think it was about selling the project. We're talking about building a hospital in Africa where there was no hospital built in a matter of more than 45 years. And having someone who played the game of basketball talking about going to build a hospital, in the middle of the season, people was like, okay, you're a basketball player, now you're going to build a hospital. How you going to do it? And how are you going to run it because you play basketball? Who's going to be watching it? It's just a waste of time. And it was not an easy project to convince people. And that's the reason why it was a little bit difficult to start the project, where we knew that it was going to cost at the beginning $14 million, and we didn't have enough money to start the project. And by the time we knew, the time ran up on us, and the project ended up costing more than $29 million some plus. And I realized that if I don't start on time, the project might go much farther again. So I decided just to cut a check of $24 million to start the project fast.
You say that so quickly. You cut the check for $24 million to move this project forward. That's amazing commitment.
Yes, it was something driven inside of me. I'm very passionate. This hospital is like my baby. It's something I want to do. I just want to save lives. There's so many women and children that are dying in the continent. Chrissy already explained the number and the statistic. It's just sad to see that the world is not doing nothing. People are talking about the Millennium Goal, but the Millennium Goal is only 12 months away. And I don't think we're going to accomplish it. More women and children continue to die in the continent of Africa. It's very sad. And some of the treatment doesn't even cost that much. Polio costs like 39 cents to have a kid, we have a polio vaccine. Measles costs like 65 cents. And to just educate somebody to give you $1 so you can give a child a vaccine. They would say, for what? Where is it going? In Africa? Oh, no. So it takes a while to educate people because even the Old Testament say people perish because of lack of education. The knowledge is very important, and I'm glad that that's why we're having this forum, to educate as many people as you can and to find a way how can we collaborate and work together to make the world a better place.
Christy, what's the one lesson that you've learned in this journey about the work that you've done, the model that you've created, that you feel like can be scaled and much more effectively be utilized, whether it be by like-minded institutions or other partners, given the diversity of relationships and collaborators that you now have partnered with?
Well, I think, the model is still evolving. I didn't set out to start a foundation, actually. I set out to contribute a piece that people could plug into and they could take for themselves. And then that sort of evolved into a campaign. And then it sort of was like, well, what is that? Where is that going to go? I mean, the MDGs were a critical piece when I started as well. And so I thought, good, there's 5 years before the goals are supposed to be achieved. We can do something within that time. And yet in every country that I filmed in, there was already the 2020 plan on the desk of the ministers of health and the ministers of finance. And so you have to think always towards the future. And it takes a lot of time to make these kinds of changes. I think the thing that's unique, I'd say a little bit about what we're doing, is by the inclusion of people from all sides of the issue and joining those voices together, being a linkage. When I see somebody like him who's built this incredible hospital, where might there be a gap? Not that there is a gap, but where is there a gap? Is it transport? Because I kept finding that no matter where you would be, if people can't access free healthcare, if it's free, or they can't access an incredible group of people who do have the education and the tools and the skills and the facility itself, then what? So we've done a lot around that piece, just providing transport vouchers so that women can get the care they need when they deliver, or the prenatal care as much as they can before they deliver. So I think it's being adaptable, and I think being smaller will allow us to continue to do that, and that's really a goal, is to stay small enough that we're not so fixed that we become one of the other giants that can't move and can't change and can't adapt.
Well, I want to make sure there's time for 1 or 2 questions of our great panelists. Anyone have questions from the audience, or this gentleman?
I'm curious how you went about proposing for the future the sustainability of the hospital. I have some limited experience in putting up a clinic in Haiti, and one of the challenges we face is, okay, we got it up and running, we got the money raised for that, and then if the donors aren't present in 10, 15 years, where is that coming from? The operational costs of keeping it going. And the word that I had was, you got to get the people within the village to be self-sustaining. And I'm wondering of your words of wisdom, I'm sure you thought about this, about how did you go about that?
I'm here with my cousin who helped me so much in this project. Dr. Lewis is sitting here somewhere.
He's right there.
We set a goal to make sure that this hospital in the next 5-6 years can becoming financially free. We knew that it can be done. We knew that despite the poverty, everyone in Africa can pay even $1 to get a treatment. They might be coming from the village, but if you tell them that you got a surgery for $200, $300, can you pay $10? That person will give you $10 because they appreciate the service you provide to them. And then we just find a way to educate the mass. And as we start doing it, we realize that the people start coming every day, start going to tell their loved one, yes, come on, you might not pay 100%, but you have to pay something. And more they was doing it, we realized that there was more money was floating to the cashier, and then we start collecting money. And that's the reason why, until now, I'm still shocked. I'm still shocked with the time that was set to see the hospital becoming financially free. And I don't want something to happen to me today and then the hospital go down. And that's the reason why, as young as I am, I set a goal to raise this money fast for the endowment. So if I can put that $10 million aside, and I can move on with my life, rest, and not putting a lot of pressure on my children that they have to look after this hospital when I'm gone.
Well, we have run out of time. So Dikembe, Christy, thank you so much for your tireless work. I think when I had the chance to talk to them prior to this panel, what was amazing is each of them saw this as just a project that they were going to focus on amongst many things. But each of them have talked about the work that they're doing as their lifelong passion, that they couldn't just give a limited period of time, that this is their lifelong passion, this is their job, and clearly they've pursued extraordinary things and achieved amazing results, and much to learn from the work that they're doing. So thank you all for amazing contributions you've made.